Good evening, everyone. I'm your doctor. Today, I'll be talking about hepatitis B virus, which is one of the deadliest viruses out there. I know most of you are familiar with HIV virus, and I know some of you also do not know about hepatitis C virus, especially the Gen Zs, which is the much reason why most of you indulge in some risky behaviors that could easily be averted. So, tonight we're going to delve deep into this topic, and this is just to educate you and also help you understand ways to avoid this and things to look out for, and also when to seek for help because a stitch in time, they say, saves nine. So today, basically, I'm going to give you facts about hepatitis B virus, and we'll get into the discussion. If you have questions, you can always message me, and I'll always be willing to answer your questions. Okay. So today, basically, we're talking about hepatitis B virus. Okay, is a viral infection that affects the liver majorly. Okay, it has a predilection for the liver. This virus loves the liver more than any other organ in the human body. Okay, so it's a DNA virus. Okay, so let's just leave it at that. Now, it is also worthy for you to understand that this virus is very common. In the whole world, there are about 250 to 300 million people living currently with this disease. Okay? So the virus can cause both acute and chronic infections. Okay? An acute infection is an infection which is not up to 6 months, but when it's beyond 6 months, we can call it an acute infection. Okay? How do you basically get this virus? Now, you can get this virus. One of the major ways that people get this virus is through unprotected sexual intercourse. You do not use condom, and you have not been vaccinated against this bacteria, against this virus. The chances of contracting this virus is very high. Okay? Basically, the virus spreads through contact with infected blood or body fluids. Okay? The other ways of getting this virus is through sharing needles or syringes of an infected person. For instance, a needle is used on an infected person, and the same needle is used on you, who is an uninfected person. So the chances of contracting the virus is also very high. The other way of contracting the virus of transmission is via vertical transmission, which is mother to child transmission. Okay? It could be during pregnancy, childbirth, or after birth or the puerperium. Okay? That's also a reason why if a pregnant woman who is hepatitis B virus comes to the doctor during pregnancy, precautions are taken, most especially during childbirth, to prevent vertical transmission. And immediately after birth of the baby, certain medications are administered to the drug, which I might not say here, to also help protect the child from the possibility of this vertical transmission. The other ways of transmission is via blood transfusion with an infected blood. If the blood is not properly screened, if the blood was collected from someone who is infected unbeknown to the person who has collected it, and this blood was not screened properly, then the chances of transmission would be very, very high. Okay. The other one is needle stick injuries, especially in the healthcare settings. Doctors, nurses, okay, while administering injections or while trying to set up a line for an infected person, you can get a needle stick injury. Okay, so that is basically one of the ways. Now, you should know that this virus has an incubation period of 6 weeks to 6 months, okay, an average of 90 days, okay. The body during this period can eliminate this virus. Believe me, many people that you know may have contracted hepatitis B virus, but the body eliminated it because during this period, the person has good immunity and the immune system flushes them out of the system. However, if beyond the 6 months mark and the virus still subsists, then it has entered the chronic hepatitis B virus stage, which is a stage that the virus becomes incurable. However, treatment can also be administered to prevent the complications of this virus. Okay, symptoms of this virus would include recurrent fatigue, you're feeling tired, fever, you're having fever on and off fever, nausea and vomiting, bloating, abdominal pain, jaundice, that's yellowness of the eyes and skin. Then you can also have dark urine or pale stool. The urine becomes excessively dark, the stool becomes pale because of problems happening in the liver. So let's keep it at that. So the acute infection, like I said, may resolve spontaneously. Okay? But when the virus has lasted more than 6 months, incubation period, then it becomes chronic. Okay? Most people who have chronic infections usually get them during childhood. Okay? So the important complications that may arise from this virus is liver cirrhosis. This virus is in love with the liver. All the virus wants to do is to destroy your liver. Believe me, it wants to destroy your liver to render the metabolic powerhouse of the body useless. And once it succeeds in rendering it useless, the person is as good as gone, until proven otherwise. Okay? The other complications would also be liver failure. Okay? The liver would fail. Okay? There are criteria to diagnose that. Okay? The other one is hepatocellular carcinoma. That is liver cancer. So you can have from chronic hepatitis B virus infection to liver cirrhosis to hepatocellular carcinoma. You'll be shocked that many people for years may not be aware that they have this virus until it has destroyed their liver to the extent that they're already having hepatocellular, they're already having liver cirrhosis. And that is the point most people come to the hospital. You know, in our community, people are always fond of treating malaria and typhoid. When they get sick, they go to the lab, do malaria and typhoid, and get medications from the lab. Sometimes the lab people ask them to go to the chemist or the pharmacist to get certain drugs, and they keep living like that. Okay, so when you have treated malaria and typhoid for a couple of times, 3 months, 4 months, 5 months, something should tell you that this malaria possibly may not be malaria. It's high time you sought the expertise of the doctor. All right. So hepatitis B, chronic hepatitis B can actually jump liver cirrhosis to liver cancer, hepatocellular carcinoma. It is not at all times that you see it going from chronic hepatitis B virus to liver cirrhosis, then to hepatocellular carcinoma. Sometimes from chronic hepatitis B virus to hepatocellular carcinoma straight. So, however, this virus can be prevented, okay? Because the vaccination is safe and highly effective. It is usually given as 3 doses, okay? Yes, you take the first month, the second month, then the fifth month, okay? Some say 3 months, but mostly give the third dose at the fifth month, okay? This alone will help protect you for a very long time. Do you understand? Out of these 3 viruses, HIV virus, hepatitis C virus, and chronic and hepatitis B virus. Hepatitis B virus is the only one that has a vaccine. It has a vaccine, but it has no cure. Hepatitis C virus has no vaccine, but can be cured via stringent measures. HIV virus has no vaccine, has no cure. So the question is, why is it that you have not taken the vaccine? Why is it that you have not been vaccinated? Let me assume that you have no knowledge of that. So after this video, after you've come across this video, what you need to do is go to a hospital, get tested. Then, if you're negative, opt for the vaccine. It is very important, it is life-saving, and it can help you dodge a whole lot of bullets. Okay? Now, the disease is diagnosed basically by doing a blood test. The common blood test, you take your blood and check for the surface antigen of this virus. Okay, if it is positive, then there are other investigations that will be done to confirm it. Then your treatment, there are other criteria that must be met for treatment with the antiviral to be commenced. Okay, there are antiviral medications which are used to treat chronic hepatitis B virus, but the essence is not to basically achieve a cure, but to reduce liver damage and to reduce the ability of the virus to cause chronic liver damage or liver cirrhosis, and that will also go a long way to saving the life of the person. Now, there are complications that would arise if a person develops liver cirrhosis. Okay? Liver cirrhosis arises basically when the liver is being damaged, and you know that the liver is an organ that the only organ in the body that regenerates. So it's an attempt to regenerate and the occurrence of fibrosis that will cause liver cirrhosis. If you did an ultrasound scan, there will be nodularity in the ultrasound scan. Then the doctor would say, okay, this is liver cirrhosis. So some of the complications of liver cirrhosis will be portal hypertension, okay? There will be increased pressure in the portal venous system due to liver fibrosis, okay? This will lead to esophageal varices, splenomegaly, and ascites. Now, the liver showed us a lot of blood. But if the liver is diseased or cirrhosed, and these blood which passes through the liver are not able to do so, they're going to seek alternative routes into the systemic circulation. Okay? And one of the veins that go to is the esophageal veins. Okay? You could have esophageal varices. And when that occurs, because the veins are not built to carry such an amount of blood, it can rupture and there will be massive upper GI bleeding. And this basically can lead to death if not handled immediately. Basically, what the doctors do is that they do what they call variceal banding, which is done by a gastroenterologist quickly to salvage the situation. Now, when it comes to ascites, that is the accumulation of fluid in the peritoneal cavity. Okay? Most commonly seen in cirrhosis. Okay? So, and because of this fluid in the peritoneal cavity, you can have infection from them. They call it spontaneous bacterial peritonitis. And this complication will continue to cause harm to the body. Okay? Now, the next one is hepatic encephalopathy. Okay? It's a neuropsychiatric syndrome which is caused by accumulation of toxins like ammonia in the body. It's characterized by symptoms like confusion. This person will not know what he or she is doing. There'll be personality changes. Someone who has been kind, normal, will suddenly become agitated, become um, rough. I've seen situations where people harm their family members. Not that they want to do that, but it's the effect of the toxin on the brain. There'll be altered consciousness. The hand will be shaking. We call that flapping tremor. Okay? In severe cases, the person can be tilted into coma. The other complications could be what we call the hepatorenal syndrome. Okay? Which is affectation of the kidneys due to the disease of the liver. Some complexes which are deposited to the kidneys from the liver would cause the kidneys to be impaired. There might be no structural kidney disease, but because of the disease process going on in the liver, the kidneys are affected in such a bad way. We call that a hepatorenal syndrome, which is a very serious condition caused by the complications of hepatitis B virus. The other is the hepatopulmonary syndrome, which is also a complication seen in the lungs due to intrapulmonary vascular dilatation from the disease happening in the liver. The patient to present with dyspnea, hypoxemia, which is difficulty in breathing and low oxygen in the blood. Then coagulopathy is another complication. The clotting factors are produced in the liver. And because of this disease going on in the liver, they are not able to produce these clotting factors. And you see, the person might not be able to clot the blood while bleeding is occurring. The person can also bleed internally because of these. And this is very, very terrible situation. The other is hypersplenism. Okay, there's an enlarged spleen due to this portal hypertension we mentioned ab initio. There will be thrombocytopenia. That is, the quantity of platelets will be low. The white blood cell will also be low. There will also be low blood volume. You see, the three cell lines, the red blood cells will be short, the white blood cell will be small, the platelet will also be low. So this person will be prone to different kinds of infection. This person will also be prone, the liver also participates in the production of blood, will be anemic, that's low blood volume, low red blood cells, which will also cause anemic heart failure if not properly handled, thrombocytopenia, inability of the body to clot blood properly. So the major feared complication will be hepatocellular carcinoma, okay, which is the strongest risk factor, okay? Yes, it's the strongest risk factor caused by liver cirrhosis, okay? So liver cirrhosis is the strongest of all the risk factors that will lead to hepatocellular carcinoma. So normally, when someone has liver cirrhosis, we have to monitor over and over again with ultrasound scan and some blood tests to monitor them to make sure that there is no transformation going on at any point in time. So the complications even goes beyond this, okay? The person can also have portal hypertensive gastropathy, okay? The stomach will be affected. This person can be bleeding from that due to the portal hypertension. You keep treating ulcer pain, while this whole thing is also coming from the complications of chronic hepatitis B. So I think we should leave it at this. But the take home here is that if you do not know your status, it's time to do so. If you're negative after testing, you need to take the vaccine. The vaccine would have to cover you. That is why when children are born, children receive vaccine against hepatitis B virus. Yes. However, the one you've received at childbirth, once the child is 15 years, the child should test. If negative, should receive the vaccination. Yes, the adult vaccination needed to cover the person through life. There could be booster doses, however, but these three vaccines, first month, second month, and the fifth month, will go a long way to cover the person from the risk of having hepatitis B virus. Okay? So if you have a question, you can ask. We will answer the question. Okay? So do not forget to like, follow, and subscribe to our channel. We'll be reeling out more health information to help you stay healthy. The basic thing is don't get sick. Yes, don't get sick. The cost of healthcare is very exorbitant in our country right now. You don't want to get sick, that's the truth, because you can't afford it. So stay safe and be healthy. Thank you and see you some other time.